Hi, Janice Wheeler here. I'm the president of the Art of Management, Inc. And we help with practice management topics for healthcare practices. Today I thought we'd take up a very annoying topic, which is called cancellations and no-shows. I call it annoying because I think it frustrates your staff and you more than a lot of other things that happen in a practice, because you're all ready, you're set, your whole team is there, they're on board, they've got their instruments out, whatever, and they're ready to go and treat this person who then phones in at the last second and says, I'm not making it, or doesn't show up at all. So we have a no-show. So I thought we'd go over some ways to prevent this, because there are some tools that we can look at that would at least get rid of some of it. Maybe not everybody, but you don't want an empty practice by throwing everybody out, right? So let's figure out how to do this. Because otherwise your schedule can just become a complete mess up of people changing and rescheduling and not showing, and where's the short list so we can fill it in, oh, we don't have time, and so on, and that's just frustrating for everybody. So let's take a look, first of all, what are some of the reasons that people cancel? I'm sure your staff could write a book on this of reasons that they've heard over the years. However, I chose 9 specific ones just because it's a variety, and we'll have a look at them, and then we'll go back through them again afterwards, and we'll decide whether they're a legitimate excuse or whether they're not legitimate, because we're going to talk about how to have a cancellation policy. And if it's a legitimate excuse, you're not going to send them a cancellation fee. If it's not legitimate, you are. So let's go through these 9 reasons first and have a good laugh, or not, and then we'll go back to them and we'll have a look at whether we're going to send a fee as a result. So number 1, they changed their mind about the treatment that they agreed to the last time they were in the practice, and that's why they set up this appointment, and now they're trying to back out of it. And so this is actually very annoying. In a way, we'll talk about this more, but in a way, it is your fault because they weren't completely firmly closed on going ahead with this procedure, or they wouldn't be phoning in and being iffy about it. Number 2 is they woke up this morning sick. Don't come in. Who wants to catch those germs anyway? Number 3, the appointment that you had with them is being overridden by something they think is more important than coming in to see you today. This is actually not a very good reason for not showing up. Number 4, they have never been educated on the value of your service. So in that case, why do they have to come? They, oh, we'll just cancel, I have a headache, that kind of thing. It doesn't hit them as being very important. The next one is the reception. This is very common. This happens. The receptionist says, okay, so let's put you in for, 3 weeks from now for Tuesday, such and such a date at such and such a time. And the person agrees to it, but she says, if you can't keep it, just let me know. Right off the bat, you just put it in their heads that it's okay to change it. So we're going to look at how we can make different wording when we come back over this again. Another reason that I chose was and this happens, their son's hockey team won the tournament last night, and so they have to go to the next level, and the game is this afternoon. And that's when their dental appointment was. So is that legitimate or not? We'll go over that soon. I came up with another one. They got informed of the last minute. Now this does happen. We have clients, we're in a city and there's downtown area, and those are the businessmen of the city that work down there, and sometimes they get informed at the last minute by their boss, there's a meeting this afternoon at 3 o'clock and don't miss it, or else. It's like a little threat there, and it's just something that they can't do to let the whole team down. And is that legitimate or not? Well, certainly on your end of things, it's not legitimate. So we'll have a look at that. Number 8, they didn't have a good experience with one or more of the staff or the doctor the last time they were at the practice, and they're a little worried about coming in. Okay, that's an interesting one. We'll have a look at that. And the last one, which I'm sure you've heard many times, their car broke down yesterday or this morning, and they can't get there. course, they're just down the street about 5 blocks, 1 bus ride away, 1 taxi ride, 1 Uber ride. Very inexpensive compared to a fee guide. A cancellation fee. So let's look back at these and see whether we want to give these credence or not. So taking up, now I'm gonna just take up one at a time, and we're gonna just check off whether it's a legitimate or it's not legitimate. So number 1, they changed their mind about the next treatment they were presented the last time they were in your practice. All right, so why are they leaving it to within 48 business hours notice? Because they were informed of that as well. So I would not consider that legitimate in the bigger scheme of things. I'm thinking in my head, yes, but they're not entirely closed. And really, whoever did the presentation, whether it was one of the staff or the doctor, about the procedure that they're supposed to come in for today, did not quite get a full close. That was not a full done, where the person is like looking forward to coming in and having that procedure done. So having them phone in and say, I don't know, blah, blah, blah. There's 2 sides to it. One is they should have done it outside of the 48 hours business hours notice, or they should keep their appointment, one or the other. I would give them a chance to talk to the doctor about this, or the person who scheduled them, and present it to them what it is that they need to come in for today, and have them handle it. If it handles, I would not give them a cancellation fee. If they decide not to come in for it, I probably would send the cancellation fee. Okay, number 2, they woke up, so that one we're going to mark it as sort of not legitimate, just because they didn't follow the rules, which they were informed of in their first visit, because we always go over the cancellation fee in the first visit. So number 2, they woke up sick this morning. Now, yes, like as I said earlier, you don't want them coming in and bringing the germs. But if this is like the 3rd time they've missed an appointment due to being sick within the last little while, like last year, I would start charging them. It's their job to keep themselves healthy. I don't mean to sound heartless, but it sounds like an excuse if they're missing a 3rd appointment in the same year due to illness, right? Now you're going to put them on a short list. If you have an opening in a day, you could phone them in the morning, or they could phone in every day and say, is there any openings today? And we would put them on that basis, come in when we have an opening, rather than having them book appointments that they don't show up for. So it is legitimate, and I would not bill them a fee for the first time, maybe even the second time. If it happened a 3rd, probably going to start billing them. Okay. The next one, we went over the appointment with you got overridden by something that was more important in their minds that came up at work or whatever. Could be many different things. Could be, their daughter wanted to have a day off from school and wanted to go shopping with them. So they're going to cancel their appointment with you. I don't think so. I mean, they can cancel it, but they're going to pay a cancellation fee for that one, because we're going to mark that one as not legitimate. All right, here's another one that's interesting. They have never been educated on the value of your service. And that really does happen. People consider it like, their hairdressing appointment, they might miss it, or going to the barber, they don't feel up to it today. We can always reschedule. That kind of attitude, And so if they really understood the value of your service, why it's important to them, what are the consequences of not going ahead with the procedure that they're supposed to, they know, if they really realize that there are staff in the practice that are standing around waiting to deliver to them, and that spot is reserved for them, it's not anybody else is going to be taking it, I think that they will have a different attitude towards keeping their appointment. Okay, it just takes a little education. And so that is not legitimate. The receptionist told, no, as I said earlier, this is the receptionist's fault, because she put it there in their heads that if you can't keep your appointment, just let me know. Right off the bat, it's sitting there. As opposed to, okay, so let's put you in for this particular time. You think that that's going to work for you. So that is yours. I've reserved it. It's yours. You own it. Nobody else can have it. I'm not going to give it to anybody else. It's yours. Just make it fun, but make it very real that is their time. All right, we'll be confirming that a month before and 2 days before. So there you go. I would not consider that to be a legitimate reason, however, because they were given an appointment and they should have kept it unless they wanted to get out of it, to reschedule it. Then that should have been done more than 48 business hours in advance. Okay. Number 6, the Suns hockey team won the game last night and they have to go to the next one this afternoon. That's not legitimate. I mean, it's awesome that their son's team won and so on, but there are ways to handle that. And maybe the husband, let's say it's the wife who's got an appointment with you, the husband can take the child to that game, or one of the parents of one of the other kids that are playing could do it. But you have a business that you're running, and you can't just have people coming and going and so on at the last second. So I would say that was not legitimate. They got informed at the last minute of a meeting at the office. Okay, that's kind of like the one I did before, but a little variation. They don't have a choice about coming to their appointment. However, it's not legitimate because it leaves your team standing there because their team needs them. And they made the appointment so they can pay the cancellation fee, and they usually don't argue about that one. Number 8, they didn't have a good experience with one or more of the staff the last time they came to your office. So they're phoning you to let you know this as to why they're not going to keep their appointment on short notice or why they didn't show up. That's legitimate. We need to get that fixed. We need to get them to talk to the doctor about the situation. If it's regarding the doctor, if it's regarding one of the staff, again, they should talk to the doctor about this so that the doctor can make any corrections or adjustments with procedures at the office so that it doesn't make them uncomfortable. And tell them that you're going to do that and get a number and a time that is the best that the doctor could call them at that time and on that number. Okay? And then number 9 was their car broke down, they can't get there. Well, that is definitely stamp it canceled. It's a canceled appointment, but you can actually do something about this one. It's really funny because I would probably say that it's an excuse probably. However, there are so many ways to handle that. Like if they're out in the country, there's almost always friends or neighbors that will drive you places. If you're in a city or a town, there's buses, there's Uber possibly, there's taxis for sure, and they usually will cost way less than your $50 or $75 cancellation fee. So the staff can say that, Mrs. Jones, why don't we figure out a way to get you here? I really don't want to charge you the $50 cancellation fee for last minute cancellation. So is there, can you get a taxi over? I see that you're not on a bus line or anything by looking at your address, but a taxi would probably cost like $10, so it's going to be cheaper. And, so don't just roll over and die on some of these, like handle them, because some staff will just say, oh, fine, you want to reschedule? Okay, good. And they'll say, when would you like to reschedule to? And they don't even attempt to handle these. So most of them should have an attempt to handle it, and especially that last one. Okay, so there are now these are some of the tools that you can use to prevent some of the cancellations. For instance, having a very good voicemail message on your voicemail when people call in after hours, because sometimes they like to do that. They like to leave a message when there's nobody there that you can't find. I'm not coming in today because blah, 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 blah. So your message machine should say something like, I'm going to read you one that we use. Thank you for calling Riverside Healthcare, or whatever the name of your practice is. If you're calling in regards to your already scheduled appointment, we ask that you do not leave scheduling changes on the machine and that you call during regular office hours. So just having that can prevent some of it. Some people still ignore it, but that will handle some. When you do have legitimate reasons, like people are not going to show up, there's nothing you can do to get them rescheduled, and you have any time at all, everybody should have a short list of patients who would have liked to come in earlier for their appointment, like sooner than what they were given, but it was fully booked. So you want to have that short list, dig it out. I know that my dentist that I used to see had his practice 20 minutes from my office. That's how long it would take, and we both knew, the receptionist and I, at the dental office knew exactly how long I needed to get there. And so she would call me if she had a cancellation and say, is it possible for you to do this appointment time, because I wasn't booked, I didn't have an appointment for another 2 or 3 weeks. And I would let her know yes or no, given how long I had to get over there and what I was in the middle of at my office. So these things can sometimes work very, very well. And patients can work with you on this, because they too sometimes have a time when they can't keep an appointment, and this is a little way for them to make up for that time that they had to cancel or they didn't show up. And they wanted the earlier appointment, and there they go, they got it. So keep that short list always close to hand. Now, no-shows are a different matter. No-shows are, they just didn't show up at all. They didn't even give you a chance to try and handle it, to get them to keep the appointment. They just plain didn't show up. And so, you sit there and you wait and you hope, and your staff are hoping, but no one appears. And so what do you do about that? Well, you're going to have to contact, and this is despite having phoned them the day before or 2 days before to confirm them, right? So how to prevent that? First of all, make sure when you do the confirm that you legitimately made it important that they show up. All right, if they don't show up, then they get a cancellation fee. That's just automatic. But if it's a brand new patient and this is their first time coming to the practice and they missed their appointment, this is not the time to send a cancellation fee, okay? You want to build a relationship. When you first talk to somebody who phones in as a shopper to book with you or to see if you're taking new patients or whatever, you want to build a relationship with this shopper. Okay, they're phoning in. They maybe haven't even decided to see your practice yet, so we call those a shopper. Some of them are looking for a confirmation that the doctor they're seeing is not going to overcharge them for something that they were quoted, and they want to see what you're going to charge. So you're not going to quote a fee. But you are going to get to know the person, and sometimes it can take 3 to 5 minutes to actually chat with the person. Do you live in the area? Do you work in the area? How long have you been there? What made you call our office? Who was the last doctor you saw for these problems? And what difficulty are we having today? And get that from them. And from that, you can tell whether it's a really urgent appointment they need to get in right away because it's an emergency, or whether it's something that can be booked more leisurely. You want to get as much personal information, like if you hear a dog in the background barking, oh, what kind of dog do you have? Like, be a friend of this person. It's really hard for people to not show up when you've become friends through the phone. So once you have gotten all the data that you need and chatted with them a little bit and so on, and you have actually whether it's urgent or not, you can now say, okay, good. So let's get you in for tomorrow morning I have an appointment open at 10 o'clock and I have another one open in the afternoon at 3:15. Do either of those times work for you? So that's what we call an assumed close. You've gotten to know the person, you know what their problem is, you know that they need an appointment. So just go for closing them for the appointment by asking them this time or that time, rather than say, would you like an appointment, which is deadly, because they can say yes, or they may say no, or let me think about it and I'll get back to you. So you're avoiding that by assuming that they do want to go ahead and getting a time set up with them. So these are, very important. Now, the last thing that I would do before they got off the phone would be to tell them, okay, when you come in tomorrow or whenever they booked for, there's a form that everybody has to fill out when they're a new patient of the practice. And I'm going to just save some of your time by doing some of it right now, right at the beginning. So give me the spelling of your name. Okay, great. And what's your address? Okay, good. And what's your phone number, home phone number, your work phone number, your cell phone number, your email address? Awesome. And what is your date of birth, and any other information at the top of the form that you can fill in. Once they've shared all that with you, that personal information, it is so unlikely that they won't keep the appointment the next day or a couple of days later. Okay, so that is one way of preventing new patient no-show, because I know that is quite often a problem in practices. Now, cancellation policies. This is your next tool. There are many ways that you can have a policy written on it, but the simplest thing is just to have a 48 business hours notice requirement of anybody who wants to change their appointment. And everybody should have one of those for no-shows for sure, and last-minute cancellations that are not legitimate. So usually you will find that it's about 10 or 15 staff. If you were to ask 10 or 15 offenders, shall we call it, if you were to ask your staff who doesn't show up for their appointments, it's not everybody. It's usually repeat offenders, and it's usually 10 to 15 different people. And so just keep in mind, it isn't everybody. This is for specific people who are repeat offenders. They also usually give you a hard time about your pricing or your fees and so on. So you actually want to implement a cancellation policy to eliminate your problem patients or clients. Okay? So let's see. I think you want to really focus on giving ideal care to the ones who are the ones you want to keep in your practice, which is 99% of your practice, I'm sure. But you want the ones who appreciate your service and your care that you give them. Those are the ones you want to take the best possible care of, and you want to kind of weed out those 10 or 15 that drive everybody crazy and make everybody stand around with nothing to do. Okay? They probably won't even pay the cancellation fee either, those kind of people. So when I'm going to go through the step-by-step on implementing a cancellation policy. So number one is, do you have an existing policy? Why don't you get it out and dust it off and see what you've got? Staff may be completely unaware that this was ever written in some prehistoric time in your practice. If you don't have one or it's not adequate, number one, develop and put in writing a cancellation policy. And then you need to notify all your patients or clients. So one by one, you're going to have to tell each person that comes in from that day forward, every single person, it has to go in the computer, in their chart. So it says cancellation policy gone over or something, or you have a thing where you just check the box, cancellation policy talked about, right? So that way you know when somebody misses their appointment that they have been informed of it. Number three, when they are booking their appointments, remind them that there is a cancellation fee if you don't let us know. If you can't keep the appointment, we need to know 48 business hours in advance so we can get somebody else into that spot who was wanting to be booked earlier. So just keep that in mind, but hopefully you keep your appointment, because that's the whole idea. We want to have you come in and take care of you and give you the service that you deserve to have. Okay? Put that message on your voicemail that we talked about. Don't leave cancellation messages on the phone. And then number 5, this is very important, enforce. I have a staff member who actually is a dentist, and he said how he used to handle it was like, don't worry about it this time, Mrs. Jones. And he would feel very benign about it. And the patients would be very appreciative, but they're going to do it again, and they're going to do it again, and they're going to do it again. And that's a lot of lost income. You can be very nice about how you do it. In fact, I'm going to give you a very cute tool to take away some of the sting of it. So you have to apply the policy. Number 6 says apply the policy with discretion, which we went through what's legitimate, what's not legitimate a few minutes ago. And number 7, have the cancellation policy the next time you reprint your office brochure about your practice. Make sure you put in that we have a cancellation policy of 48 business hours notice, or there will be a cancellation fee of whatever it is, $50, $75, different professions charge different amounts. Also, when you have you have an appointment card, when a patient is leaving your practice with their next appointment made, that can be printed on the card as well, on your appointment card, so next time you get them done that there is a cancellation fee if you're not given 48 business hours notice. And also, a lot of people have an email newsletter that they put out once a month. You can have a little corner box. Don't forget, your appointment, because we have a cancellation fee. Give us at least 48 business hours notice, or more if you can. So it's just, need to be nice and so on. So once you've explained the cancellation policy to new and old patients, don't forget, not just the brand new ones coming in, but all your existing patients need to know, and it needs to go in the computer. And you let them know when you're educating them on this, you let them know that in order to provide the highest quality care to them, both the office and the patient have to work together as a team, and that means the patient needs to show up to get that care that you want to give them. So you just keep it really nice and warm and fuzzy and friendly. And the practice has the best possible expertise here to share with you and to give you the best possible service, but you need to come. This appointment time that we've done, I'm just reading you some of the things. Your appointment time is reserved exclusively for you. Okay, making that known to them. And from there, we want to look at what are the procedures for enforcement of this policy. So number one, you could have it be a verbal warning the first time, like, okay, this is the first time that you've canceled. There's several ways you could do it. You could just say that, and we won't charge you this time the cancellation fee, but just know that we would next time. Or you can do, this is mine, I like this way better. I would say, listen, we have a cancellation fee, as you know, and you just missed your appointment. So what you don't know, because I'm just looking in the computer right now, and I see this is the first time you've done it since we put the cancellation fee in. So what I have, the computer allows me to do one free pass the first time this happens. So would you like to take advantage of that today, meaning you don't have to pay the fee this time? Okay, but it only lets me do it once. So I have to let you know that, okay? So would you like to take the free pass this time, or you want to save it for next time and pay the fee this time? Oh, you want to take the free pass. They're always so happy that they get this free pass. Right away, you've made them back into a friend, and they're not upset anymore. In fact, they're quite happy that they just got relieved of having to pay that fee. But they have been warned that that's the only time it can happen. So little shock, nice comeback, and then they've been warned. So the second time, you definitely are going to charge them the fee. The third time that they don't show up for an appointment or cancel at the last minute, you got some choices to make here. Number one, you could send them a letter asking where they'd like to have their medical records sent. In other words, we're not servicing you anymore. Now, some people will call in about that and say, oh God, I am so sorry. I didn't realize it was that important. And can we be friends, and can I come back and see you guys? It actually acts as a little shock thing. Or you can put them on the same day booking notice. So they can phone in the morning and say, do you have any appointments available today? And you can say, yep, I have one at 3 o'clock. Good, put me in for it. So that way they're not pre-booked where they can actually cancel, but they actually can have same day appointment. Or you can put them at end of day also. That's another option that some doctors do. Just, okay, let's fit them in. But that can mess up your staff's life if they have to stay late, and yours as the owner of the practice. So now I'm going to go over some exceptions to the rules. Let's say you have a whole family that comes to see you as patients, and one of them, I'm going to be mean, I'm going to pick on the father. Let's say the father is the repeat offender who does not come. He's a chronic offender. Well, what you can do is deactivate him, i.e. do not call him for appointments. Just let it ride. If he wants one, it's up to him to phone in. The other patients of the family may mention it too. Geez, you haven't seen my dad for a while, or you haven't seen my husband for a while. You say, oh, well, we haven't been calling him because he doesn't keep his appointments. So if he wants one, he can call us. Okay, good. Number two, they're upset about the cancellation fee. That would be an exception where you wouldn't charge it and you give them the free pass if you take my suggestion. And number three, a tougher cancellation fee for prime times. Like a lot of patients want evenings or Saturdays. Let's say your practice is open those 2 times, like 2 nights a week and Saturday. Those are usually your prime times. And patients who miss their appointment in that time are not going to be given that time again. So what you do when you're booking the appointments is say they got an evening appointment or a Saturday, say, just so you know, the cancellation fee is doubled if you don't show up for those, because that's our prime time and everybody wants those times. And I have to have time in order to call people if you need to cancel. So let me know more than 48 business hours in advance, or you'll be paying a fee. I don't know how else to say it nicely to you. It's just that these are prime times. Also, you know in your head that you're not going to give them a prime time again if they fail to show up. If they no-show, cancellation fee, and they don't get booked in those times again. So that's another tool. So there's one more. There's the sign for your front desk. It says on it, cancel, and I'm going to read you what we have. This sign should say Cancellation Policy, sort of the heading. Then you put, your appointment is reserved exclusively for you. If you will be unable to keep your appointment, we ask that you give us 2 working days notice so that another patient can be seen in that time. Failure to notify us may result in a cancellation fee being charged to your account. Your cooperation is greatly appreciated. All right, so that notice on the front desk, people may or may not see it, but you can bring it to their attention when you're scheduling them and so on. And I came to the end of today's webinar, and I hope that I gave you some good tools that you can use. Now, we do offer just a little extra thing I want to add. I do a free practice analysis with practice owners who want to find out what their full potential is and whether we could help them achieve that. And it's completely free. It's 3.5 hours long. We ask a lot of questions. You answer a lot of questions. I tell you about our program and our services, and at the end of that, you go away and you make up your mind what you want to do. So don't be shy. Meet with me. I have analyzed over 6,000 practices, so I have a lot of data in my head about how different ways things can be handled. So give me a call. I look forward to it. Bye for now.